Thank you very much for inviting me to speak at this meeting. Tēnā koutou. I think as Peter indicated, I'm not a clinician. I started my career as a plant scientist, but about 20 years ago, I got drawn into the field of nutrition and particularly drawn into the field of cancer and specifically prostate cancer. Most of the work in nutrition is epidemiology, observation. You try and work out what people eat, then you see whether they stay well or get ill, and it's association. I'm not an expert in that area, but I'm going to talk to you a little bit about that. The last talk we heard about was very much about late-stage disease, and I'm really going to talk about early-stage disease. And I think my experience of working in the UK, we've done several interventions with men with early-stage prostate cancer. And I think that the message we always gave, there's no magic bullets. There may be some reduction in risk, but we don't know. The level of evidence we can give is not that same as drugs, but it's something you can do. And there's no risk associated with it. And of course, it's all got to be done in consultation with your clinician. So if I can start, but I'm going to start with two introductory slides before I get on to talking about the nutrition work, just to put some of this work in context. The first one, which of course, as I said, we've mainly been dealing with men over many years who've got early stage and low risk or intermediate risk prostate cancer, organ confined. We did a study, though, where we actually looked at what genetic changes were happening in these small tumours. And this was done on prostates from radical prostatectomies. We were able to get these, and they were sectioned. We worked with clinicians, molecular geneticists, and such like. But the interesting thing we found was that while you can see this pink is the kind of tissue that our pathologists told us was histologically normal. And the yellow and the green and the red are different cancers which have a separate origin, and often you get independent origins in these prostate in an aging man. But what we found was actually in this tissue here, the normal tissue, there was really extensive mutations going on. There were lots of changes in those. And this goes back to quite an old concept of a field effect. And while trying to work out why some cancers become metastatic or expand out of the prostate gland and others stay within, most of the emphasis has been on looking at those tumors themselves. And there's been much less emphasis on looking on the tissue around them. Now, diet and exercise, I'll talk a little bit about exercise, probably affects that field, the field in which those tumors are. And I'll give some, and later on I'll give some experimental results where we actually specifically focused on how diet might change that area to reduce risk of aggressive cancer. The second context I wanted to put in was the difficulties of doing intervention studies. It's quite difficult to do kind of the gold standard randomized controlled trials with placebo with food and diet over a long period of time. We can do some, and I'll give you an example later on. You can, of course, with drugs, and you can also with supplements. And this was a study which you've probably heard of, the SELECT study undertaken in the United States. It was started in about 2000, 2001. They recruited over 35,000 men into this study. And there was 4 kind of interventions. They gave men a reasonably high dose of vitamin E as an antioxidant. And the hypothesis that this would reduce the rate of prostate cancer developing in these men. There was also a selenium and a mixed arm. And of course, you probably know the story that was stopped in 2008. It was meant to run for about 20 years. It was stopped in 2008. And it was stopped because the men having the vitamin E were having a higher incidence of prostate cancer. And about a similar kind of time, there was a number of other studies which also shown that not just men, but men and women who are having high antioxidant supplements did have a higher increase of rates of certain other cancers. Now, we'll come back to this later on to try and provide an explanation of diet and the whole notion of oxidants and antioxidants, which is very, very confused and misleading, I think. So let me go on to talk a little bit about some studies. And most of the studies I'm going to talk about are not ones that I've done. They've been largely done in the United States, because the United States have a long history of doing very large epidemiological studies. I'll come back to some of my work a little bit later. And if you think maybe 20 years ago, the nutritionists, and I'm not sure if I'm one of them or not, were telling you what not to eat. And then they began telling you what you should eat, and now it's mainly trying to work out dietary patterns. And this is a study published a few years ago. It came out of Harvard, and it utilized the Physician's Health Study. And this is a big study. It was set up in the 90s. They've recruited tens of thousands of physicians to this study, and it's used to look at a lot of health different outcomes. And you can do subsets from this. And so here's one subset where they recruited almost 900 or so men who had non-metastatic prostate cancer. They had very good, or as good as you can get, dietary information about these men, what they were eating over a period of years. And the follow-up was 10, but probably about 15, 20 years after they were initially recruited into the study. And what they did, they took the men and every man, they defined two dietary patterns. So there was I can see it there, a Western eating pattern. And as you can imagine, that was things which maybe are not so good for you. And a prudent eating pattern. Let me explain. The Western eating pattern, they gave every man a score, whether they were high on this score, or moderate, low, or least. And that was really involved with how many of these kind of foods were in their diets and how frequently ate them. And they also had a prudent eating score. So again, it's rather similar, but in this case, it mainly focused on other things in the diet which may be somewhat better. And it's probably not surprising what the outcome of that study was. If you look at the greater adherence to the Western dietary pattern, men who were most adherent to that had an increased risk for all-cause mortality. Because this healthy diet pattern is not specific to prostate cancer, it's not specific to cancer. Heart disease, stroke, certainly some neurodegenerative diseases, they all benefit from this healthy eating pattern. And you can see that because this number is greater than 1. If it's greater than 1, it means you're more at risk if you really strongly adhere to that Western dietary pattern. And you can see for prostate, all prostate cancer-specific mortality, again, you can see your enhanced risk. And again, what you might expect if you have greater adherence to that prudent dietary pattern, you have a lower risk. So this is a lower risk for all-cause mortality and a lower risk for all prostate cancer-specific mortality. The big variation here is not actually statistically significant. And of course, this prudent diet is what is largely referred to as a Mediterranean diet. The good thing about this diet is it doesn't exclude anything. So you can eat really what you like. It's the frequency of what you should eat those foods which are important. So if you like a lot of highly refined carbohydrates like sweet foods, if you like, really meat, you can eat those, but you just don't eat them very frequently. Same with dairy products. Again, eat them, but maybe not quite as frequent as maybe you might otherwise. I would not particularly advise the low-fat ones. Low-fat is usually replaced by sugar. Fish, seafood, and the vegetables, it's quite well known, this dietary pattern combined with exercise. When we've often talked about this, people have said, well, yeah, that's fine, but we're an island in the South Pacific. What are you talking about the Mediterranean for? And I would just say that there's quite a large project running in New Zealand at the moment, which is looking at how we can adapt that Mediterranean diet specifically for New Zealand, where we're looking at foods grown in New Zealand and companies who are making those foods. And we have an intervention study running at the moment across a large part of New Zealand. It's largely focused on diabetes as an outcome, but it will inform other way, and that will finish in about 18 months. What about moving on, though, and saying, let's look at any specific foods that might be of more importance to prostate cancer. So if you can adopt that dietary pattern, but is there anything that may be more beneficial or not? And here the evidence is not that good, but there is some evidence. I'll just begin talking a little bit about tomatoes. And I only say about tomatoes because there was a lot of interest in tomatoes, and people still are talking quite a lot about tomatoes. And the reason is that there was actually quite a lot of evidence coming out in about 2003, 2004 from 3 or 4 studies in America, which did show that men who had a diagnosis of prostate cancer, if they had quite a lot of tomatoes in the diet, there was some reduction in risk. The risk was not associated with fresh tomatoes. It was associated with processed or cooked tomatoes. And there was some interest in this compound called lycopene. Lycopene is the compound that gives tomatoes its red color. And in fact, a lot of men started having lycopene supplements. I'm not a great advocate of supplements. The reason that lycopene was thought to be important is that if you cook your tomatoes, and especially if you eat them in a meal with a bit of oil or fat, you have much greater absorption of lycopene than if you eat fresh tomatoes. Now, the early data was strong, and it left the FDA, the Food and Drug Administration of the United States, to a very stringent regulatory authority that actually allowed a health claim with tomatoes against cancer, not specifically against prostate cancer. More recent studies, the evidence does not look so strong, and while the FDA still have a claim, it's of less, and it's actually specific towards prostate cancer, saying there is some evidence, but the evidence is not very strong, and I would support that. And it may be the case that tomato consumption maybe is more associated with the absolute risk of prostate cancer as opposed to prostate cancer progression. We heard a little bit about DNA repair earlier, and lycopene and carotenoids are actually, they assist DNA repair, so maybe something like that. And if you're interested in eat tomatoes, process them, eat tomatoes rather than supplements. They are very chemically complex foods. The data that got me more interested in prostate cancer was a study that came out from the University of Southern California, and that's one of the main centers that are doing this work now. And it really did a much more detailed analysis of vegetable and fruit intake after diagnosis of low or intermediate risk cancer, and to try and work out if there was any association of progression. Just pulled out a little bit of data from that paper. This is looking at the median intake. So this is portions per day. And you can see that it's not really again, we're looking at that number being less than 1. And you can see, well, you've got to eat an awful lot, and it is less than 1, but it's actually a little bit questionable. When they looked at the cruciferous vegetables, they actually found a much more significant effect. Here's portions per day. So this is eating them, once every 5 days, once every 2 or 3 days, and this is almost once a day. But it was actually fairly strong evidence. And there's been 4 or 5 other studies which have provided similar data to that. And this is what those vegetables are. These are the cruciferous vegetables, the broccolis, the cauliflowers, the cabbages, the kales, Chinese cabbage, pak choi, things like that. And there's quite a lot of evidence for those now. And that's really why I got my interest in there. In fact, I was approached to do some studies with urologists. And if you look at these vegetables, they're full of all sorts of things, like most other vegetables and fruits. The difference is they have this compounds called mainly glucosinolates, other sulfur compounds, which you don't find in other vegetables. There's some similar compounds in garlics and leeks and onions, but they're not quite the same. I'm going to show you a little bit of chemistry next. The details are not that important, but the concepts, hopefully you'll get. This is broccoli. It accumulates one compound called glucoraphanin. This is the structure of the compound, gluco, and this is glucose here. This end bit is glucose. The S stands for sulfur atoms, and you can see it has 3 sulfur atoms. When you eat that, what happens? The bugs in your gut cleave off that glucose. They want to eat that themselves. And you end up with this compound called sulforaphane. It's a mustard oil. And you absorb that into your bloodstream, and it goes into your cells, and your cells absolutely hate it. It's really bad for the cells. It depletes a compound called glutathione, and it puts the cell under stress, oxidative stress. But what happens then is that the cell switches on all its repair mechanisms, all its detoxification enzymes, its cellular defenses. It excretes it from the body. The cell recovers. It gets back to a healthy metabolism. It changes the gene expression profile. Whoops. And it retunes our metabolism. Just very briefly, I was working this compound for a long time. Here's myself in the 1980s, and collected plants from Italy, and I can do that. We used those to develop broccoli lines with enhanced levels of glucoraphanin. And that meant we could actually do that trial, and we did those experiments with a lot of people, and then I was approached to say, well, what about prostate cancer? And we did 4 interventions. Now, I'm not going to go through the details, but you remember the transperineal biopsies. We recruited men who were on active surveillance, who had intermediate risk, and we took transperineal biopsies. We then selected biopsies in areas of the prostate which was unlikely to have cancer. Men then went on a intervention for 12 months. They had 1 portion of soup a month for 12 months, one portion of soup a week for 12 months. After the 12 months, they all wanted to continue, and they continued for another 12 months. But after that first 12 months, we took another set of biopsies, and we looked to see what was going on. We had some association with advancement of grade that pathologist was giving us. But we looked at another, let's go back. This is what's called a volcano plot. And it looks like, a bit like a volcano, it looks like lots of things happening. This is the change in gene expression in a man with active surveillance from over that 12 months period. So we compare all their genes, so 25,000 genes, after the intervention to before, And you can see there's lots of changes. The red ones are going up, the blue ones are going down. I won't go all the details of that, but most of those changes are associated with inflammation, associated with cancer. If we increase the glucosinolate content, you see, well, there's a few less. And if we do the very high ones, we can actually stop all those changes. So we can attenuate those changes. And that's a bit of experimental evidence which was consistent with if you have a high lot of cruciferous vegetables in your diet, you may reduce the risk of cancer progression. Finally, I'm just going to talk a little bit about exercise, because exercise is the other thing which there's a lot of interest, and I was pleased to see a poster outside and also a leaflet in your bags about this. This is a study, again, it's from the same group in Southern California, where they looked at men again after diagnosis, and they showed this was the subset of this started on walking. It wasn't so much the extent of walking, it was a speed that men walked at. If you do walking more than 3 miles an hour, that's a brisk walk for 3 hours a week, they were getting a significant reduction in the risk of progression of the localized prostate cancer. Now, everything I've talked about is that earlier stage. There is a study in America now going on which is looking at diet and men after a radical prostatectomy. This is the protocol that's been published recently. They're recruiting men into 4 groups: exercise only, diet and exercise, diet only, and then no intervention apart from a bit of advice. I'm not going to go through it in detail, but the dietary intervention or the dietary advice they're given is really similar to what I've been saying. They're advising men to have cooked tomatoes, maybe a few times a week, cruciferous vegetables, increase their vegetable oil consumption, and have fish. So that study is running now. It will probably report in 2 or 3 years' time. I'm going to finish just with 2 slides, and I'm going to say that eating broccoli, walking, going to the gym is actually doing the same thing. Because when we eat these, we're inducing acute oxidative stress. And you know that if you go to the gym, if you have a brisk walk, you get a bit out of breath, you feel a bit exhausted, and your tissues are under stress. That switches on our natural defenses. It switches on our natural defenses. That restores the metabolism. And we think that is what reduces the risk of various cancer clones from expanding. There's not hard evidence for this, but this is a hypothesis. And where do those antioxidant supplements fit in, like the vitamin E and the vitamin C? What they do, they stop it. They stop our own defenses being switched on. They flood the system. And this is why we think taking those high-dose antioxidants is probably not good for your health. And finally, my final slide is just to put this in a bit of a broader context. As we age, our tissues just get a bit tired. We increase oxidative stress in our things. It's a bit curved like that, not quite sure. This is because our mitochondria, these are our engines in our cell, as we age, they stop working so well. We can't do anything about it. When we're born, they are perfect, and as we age, they just start misfunctioning. And these age-related chronic diseases, they're not caused by this. They're not caused by it, but they will prosper in this environment of increased oxidative stress. And what diet does, whether it's a Mediterranean diet or exercise, it just flattens that curve a little bit. And that's all it does. It reduces our risk. There's no magic bullets, but we can try and help ourselves by adopting a healthy diet and some exercise. And with that, I'll finish and thank many people. I've worked with many clinicians over the years, of which we couldn't have done any of this work. So thank you very much.